The hummingbird.
Facial movements. Big personality speech. The broca.
What's the difference between the three types of myasthenia gravis? What's the first one?
One's too much.
Tensilon.
Oh.
Bradycardia, because the tensilon causes severe bradycardia, so what can we give?
I read that wrong.
Now, when we get to the final, isn't it fun how we can combine neuro and cardiac in the same?
No, not really.
No, it's not.
It is not.
But you already know that.
So what was the answer?
You already know that answer.
What did you say?
Go back to the basics. Okay, what's the other crisis? Cholerogenic, yep.
Oh,
What
the
is it?
Cholerogenic. Too much medications on board. So they still
the one
have
that's too many or too little.
weaknesses. But what's the other last one? Myasthenia? So what's that one? Not enough medication on board. What's the difference between the two? So cold-like symptoms. Which one has got the increased saliva increase?
The cholinergic.
Cholerogenic. Because why? How is the TIA different than a stroke?
24 hours to 24 hours.
What about
Symptoms resolve. Resolve.
What are 4 nursing interventions that you would not do with a patient with dementia?
No reasoning.
Put them by elevator, stairs, raise your voice. Anyone else have something that they would like to question? Play loud music, scream, or restrain. Yep, I would accept all those. Which stroke has a slower onset of symptoms and which stroke has a sudden onset of symptoms?
Thrombolytic is slower. Hemorrhagic is faster.
Thrombolytic, that's where I was going, but hemorrhagic, that's
Yeah, it's faster.
sudden. Well, there's two types of ischemic strokes.
Thrombolytic.
Thrombolytic and embolytic. Which one has a sudden onset?
Embolytic.
Embolytic, because that clot all of a sudden came from somewhere and got stuck. Where the other one is just a slow progression.
Okay, so we weren't talking about hemorrhagic.
No, but I would accept that. If that was the choice, that would be that has a question, and I would accept it. What is an aneurysm?
A bleeding brain.
Blood
Blood vessel
bleeding.
to bleed.
Ruptured vessel.
The aneurysm is the actual ballooning
Oh.
of the vessel, and if it ruptures, you'll hear the aneurysm is ruptured. But, so what's the symptoms? This is extra headache. Symptoms of a ruptured aneurysm.
Headache.
Severe headache.
Worst headache of your life, nausea, vomiting.
Abdominal pain. That's a ballooning vessel. She's talking about.
Yeah, it's immediate, yeah. Correct. If a brain aneurysm ruptures, it's immediate, like, I have the worst headache of my life. And vomiting is not like drooling down, it's projectile vomiting. So, well, you have something being enlarged, ballooning in your head, what would you have?
A headache.
Headache, but probably not like
Increase pressure.
Increase in cranial pressure, think about it, where is this aneurysm?
In your
The
head.
brain.
Yeah.
In your brain.
So you might have some neurodeficits depending on where it's where it is. But if it has rupture, you're gonna have those sudden, worst headache in the life, severe headache. What is agnostic?
You can't feel sensation.
Recognize a familiar object. Sometimes with the neuro, just knowing the definition of things can help you answer test questions, because I might not have a test question on this, but if you see this on a test, you're gonna go, well, I know what that is, so I can rule it out quickly. Okay? Why is Glasgow important? Glasgow.
Helps with mental consciousness.
What imaging study will be ordered when we question a stroke?
CT.
Without contrast.
How do you manage cognitive deficits in a patient with a stroke? Cognitive. Reorient them, establish a means of communication, limit choices, all those kind of cognitive things. What would you question if nasal drainage is positive for glucose?
CSF leak.
Leakage, but why?
Intracranial pressure.
Meningitis.
So, there's probably no back history on this, but if I see nasal drainage from, that's testing positive, I
Bacillus.
got leakage, but why do I have leakage? Skull fracture.
What is
So
that
there's
one
a
called?
fracture
The
somewhere.
with the eye? What is the
That's-
raccoon
yeah,
eyes?
After an accident, like a head trauma, they might have the, battle sign.
That battle sign. Okay.
Or raccoon eyes. You know, we talked about something at clinical with the NG yesterday, and one thing I didn't say, and I haven't seen, if you suspect cranial fracture, are we gonna start an NG?
No.
No,
Great.
It's
Did you miss 10? I'm somewhere, don't think I have 10.
10 was the agnosia one, I think.
Agnosia,
Then what, okay, what was
not
9?
recognized objects, familiar objects.
What was 9 then? I'm missing one of them, 9 or 10.
Oh, temporal lobe stroke, signs and symptoms. We don't have it.
Oh, what would happen if you had a stroke in the temporal lobe?
Broken one.
Sorry.
What is,
What was 9?
All right.
Broken words.
Broken words. Temporal lobe.
Respiratory dysfunction is related to what level of injury in your spinal cord?
Brainstem.
Cervical.
Oh,
Your
so.
C3 to C5 keeps that diaphragm alive. What are 3 risks of neurogenic shock? Age. What kind of age and who specifically? White elderly, falls, spinal injury, motorcycle, or
Motor vehicle accident.
accidents, teenage boys because they like to drive fast. Not me, I don't like to drive fast.
Drunk drive. No.
What are the priorities interventions for autonomic dysreflexia?
Sit up.
Huh? Raise the head of bed.
Sit 'em up. Remove clothing that's constricted.
Check the cause. What are your signs and symptoms of intracranial pressure?
Widened pressure, high blood pressure,
Widened pulse pressure,
hypertension,
hypertension,
bradycardia,
bradycardia,
bradypnea. Well, that's not one of the
decreased respiration.
these.
And abnormal temperature control, like it's usually very high. We had one, we heard that one was 110 today. That's pretty high. That's the highest I've ever heard or seen or witnessed. Yeah, oh yeah, they're great. Cooked it, he said. It's done.
Wow.
Yeah. What is the doctor retrieving when doing a lumbar puncture?
CSF.
Okay. Why is a swallowing valve important on someone who has a neurological deficit?
So they don't aspirate.
Airway. What are 3 different reflexes to test for meningitis?
Bradinsky's, the K, Budinsky, Buduska.
And
Babinsky, Babinsky, Kernig.
Who the heck came up with that?
Right?
What are the 3 differences between viral and bacterial meningitis?
Clear for viral, cloudy for bacterial.
You think I can hear you people? No. Only a few voices that I can hear. It's like you all talk at the same time. All right. What is spinal fluid? What is that?
Clear for
Clear
viral,
versus
for the viral.
Cloudy.
Cloudy for bacterial.
Wait, which cloudy is the bacterial?
Bacterial. Okay. What's another?
Viral has no organism in bacterial.
Viral has no organisms, and then bacterial does.
Protein on the bacterial.
Viral, we treat the
High
symptoms.
protein.
What kind? Droplet. Oh, droplet precautions for bacterial.
Unless it's a TB, right? TB. Right, so if it's a TB meningitis, then we do.
What's the difference between a clonic and a tonic seizure?
It said TB meningitis.
Hypertension or tonic. What type of headache happens at the same time of day? What are 4 things a nurse should chart after a seizure?
Time.
Frequency.
Level of consciousness.
Characteristics.
Pupils. Motor
Everyone
speech.
get them all right.
Yes, we all did. Yeah, I did.
Anyone, seriously, you got them all right? Raise your hand.
No. What? Is it candy first? No, I didn't get them all right. I'm just
You got 24 right, 23 right, 22 right. Okay, 23.
I got 23.
I didn't. I got like.
Number 23 or 23 questions right? Because I got 23 right.
Because we got one for that.
I'm surprised I got some of them right. Like several. Like I had seen that before, but I never thought. I thought that one time where I couldn't see my grade, I thought it was because I went over the time. That's why I never did it again.
I didn't know we had. I remember to do like a
I had like 1 second shit off.